but the practice was going in a different direction. I started out as a traditional ophthalmologist, and I felt that traditional ophthalmology had all the answers. And, after finishing medical school, you have certain ideals and standards, and I thought I had all the answers. And then after practicing for 25 years, I noticed that many of my patients were still losing their vision. Many patients were, getting worse, and they just weren't satisfied with traditional medical care. And I'm not saying that, all things with medicine are bad. As a board-certified ophthalmologist and a homeopathic doctor, I kind of wear two hats. One hat is traditional ophthalmology, the other hat is alternative. Probably the biggest change that occurred was a personal experience that I had. I developed severe adult onset asthma, and I was under traditional medical care. I was taking an inhaler, steroids, and Theodore, and my life was miserable. And it just so happened one of the top pulmonary doctors in the city was my next door neighbor. And I said to him, I want my old lungs back. Here I am, I'm athletic, I was doing triathlons at the time and running marathons. I mean, what can anything be done with my lungs? I mean, why can't I get my old lungs back? And he said, well, nothing can be done. You just have to take your medicine and be glad the medicines are helping you. And I'm sure many of you here have heard that too. You have macular degeneration, you have glaucoma, you're losing your vision, and the doctor tells you nothing can be done, or you're getting injections, you're taking eye drops that are causing side effects, and you just wonder, is there something different? And that's what I began to search. And then during my triathlon experience, I met some professional triathletes who introduced me to some homeopathic remedies. And I was using those homeopathic remedies for muscular strains and injuries like arnica, rhus tox, and ruta. And they worked well, and I was really surprised. And I started to wonder, well, maybe homeopathy could help with my lung problem. And so I consulted with the homeopathic doctor, and the first remedy she gave me didn't do much at all. The second remedy, I thought I was breathing a little bit better. But the third remedy totally cured me of my lung problem. I mean, cured me. That was just unheard of. And then I thought, well, maybe homeopathy can help with patients with eye disease. So I began to do some research, and I was shocked. At the turn of the century, there were many ophthalmologists who were homeopathic doctors. They had their own journal, their own society, and I got a copy of the proceedings from the Pennsylvania Academy of Homeopathy and Ophthalmology. And they actually presented at meetings, eye diseases treated with homeopathy. This was in the early 1900s and late 1800s. And matter of fact, Eye and Ear Hospital in New York City was strictly homeopathic, if you can believe that. So then I began to incorporate a lot of these modalities in my practice. And then that step led to me being introduced to microcurrent. And then I discovered color therapy. And pretty soon, there was such a tremendous demand. Patients were so interested in these alternative therapies. I said to myself, I was trying to do both at that time. I was doing cataract surgery, retinal surgery, laser. I had to make a choice. And I was just enjoying the alternative therapy so much, I decided I'm going to give up traditional. I mean, I still go to the traditional meetings and still maintain my board certification. But my true passion and love now is alternative therapies. So I'm really grateful that you folks are here to learn more about it. And of course, many of you here are my patients already. And I don't really look at you as a patient, I look at you as more of a friend, because I look at alternative care as more like a partnership. You have a problem, we're working together to try to find solutions. And sometimes that solution may be traditional surgery. It may be doing something alternative, but we have to decide what's going to be the best course. But I think generally speaking, that the alternative route is probably much better, because in alternative medicine we're looking at strengthening the body, treating the underlying problem, and somehow developing methods so your own body can heal itself. You know, traditional medicine, we're always looking for a shortcut. You know, I have this problem, I have a headache, let me take an aspirin. In alternative therapies, we kind of look at the underlying problem. Now, what we're going to do today, there were some questions regarding the outline. We're going to go through, in the morning primarily, we're going to learn kind of like the building blocks. We're going to go through each of the different modalities that I use in my practice. And then in the afternoon, later on in the afternoon, we're going to specifically talk about different diseases, macular degeneration, glaucoma, cataracts. And then we're going to end with discussions and questions, anything you might have, and we'll stay here as late as needed until all your questions are answered. And we are going to have a short break in the morning, and then we're going to have a break for lunch. I'm also pleased that Dr. Dennis Courtney is going to be speaking on chelation. I don't know how many of you here know Dr. Courtney, but he's a very prominent alternative medical doctor here in Pittsburgh, and he's very active with chelation and other alternative therapies. And also I'm pleased that Dr. Charlie Steinberg is in the back. You want to raise your hand? He's an alternative optometrist, and he's trained in microcurrent, and he's also trained in color therapy, which we'll be talking about. So those of you that are from this area here and you're looking for a local eye doctor, Dr. Charlie Steinberg is very competent and knowledgeable on a lot of these modalities that we're going to be talking about. So do we have any questions so far about the program and the setup? Then starting on Monday, Tuesday, and Wednesday, we're going to be having our 3-day treatment program. And this is an opportunity, if you're interested in some of the modalities and things that we've talked about, it'll be an opportunity to have a complete eye examination, and then you'll have 3 days of treatment. And the purpose of this treatment program is to determine if any of these treatments will help your eye condition. If you have macular degeneration, we hope after some of these treatments that we're going to talk about, you'll notice an improvement of your vision, color, perception will be better, contrast. If you have glaucoma, the same thing. We're going to see if these treatments lower your pressure, improve your vision. And then if we're successful over those 3 days, if you do notice an improvement of your vision and your eye pressure is better and we're getting a positive result, then we would like you to go home then with these particular treatments, so you can do them at home every day, and then we can do follow-up examinations either through a local eye doctor here. Since most of my patients they live outside of Phoenix and I reside in Phoenix, we can do that by a telephone consultation. So every 3 months we like to follow up on by telephone. But at the 6-month visit, it's important you do have an eye exam, and send the records to me.